Greetings, my friends. Today we have a topic that I think is very, very current. Um, an experience that many people have in various degrees, from severe to moderate to minor. And every experience is different with each person. And our topic today is depression. It's a mood disorder of types, and there's as many different experiences as there are people. Now, I'm very fortunate to have here as my guest today, Andi Van Couverden, who has experienced depression. She's going to tell her story. She's going to tell her story, and in that story, we would hopefully generate hope, hope and reason for hope for people who are experiencing depression. And I'll just turn it over to Andi now and allow her to begin to tell her story of when this happened and what it was like to live depression for whatever length of time you lived it. So I turn it over to you, Andi. What would you say?
Thank you, Father Leo. Glad to be here today.
Welcome.
Thank you. So it's curious, driving over here, I realized that it was 20 years ago, almost to the day, that I was diagnosed with severe depression.
Mm-hmm.
So it was in the fall of 1999.
Mm-hmm.
I had just moved to a remote community a month prior to my diagnosis. I used to be a teacher,
Mm-hmm.
so at that time I went back to work, I think a little too early.
Mm-hmm.
My son was 9 months old and my daughter was 3.
Mm.
And I went back to work. I had a history English classes in high school at that time. And round about the third week of September, I just wasn't feeling right.
Mm-hmm.
My mind was racing in the middle of the night,
Mm-hmm.
and I couldn't sleep. So I was experiencing insomnia.
Mm-hmm.
And of course, I'm a perfectionist,
Mm-hmm.
so I just continued to push on and keep
Yeah.
going. And I remember there were all kinds of signs and symptoms that I didn't recognize.
Right.
Because being a perfectionist, you think,
Right.
oh, this wouldn't happen to a perfect person, right?
That's right.
Right. I know a lot more about myself today. I remember I was doing the laundry one night and I was folding my kids' socks and I could not match the socks up.
Right.
It was bizarre. And I knew I had some marking to do, so I stopped doing the laundry and I spread out all the students' projects. And I started to evaluate their work, and I couldn't think straight.
Mm-hmm.
I still hadn't broken down into tears,
Mm-hmm.
but I knew something was wrong. So I phoned my sister, who happens to be a nurse practitioner, and I said to her, this is what's going on in my life. I can't do this. I can't do that. Something's wrong, Nancy. What's wrong with me? And she said, and at that point I broke down. And she said, you are a classic walking textbook case of clinical depression. You must get to the doctor, Andi. Phone in sick tomorrow and go to the doctor.
Mm-hmm. So, your sister, you're lucky that you knew enough to turn to your sister who knew enough to tell you what to do.
Mm-hmm. Yeah.
And then did you go to see the doctor the
I
next
did,
day?
yeah. That was September 28th, 1999. And I didn't have a doctor, for starters, because I was in a new community,
You're right,
an isolated community.
right.
So the medical care isn't what it is in larger centers. So I presented my story to this doctor, and he said, yeah, you're depressed. Gave me a prescription
Prescription for pills. Yeah.
for pills, and so I took that and went back to work.
Mm-hmm. Mm-hmm.
And it was the next day. I was standing in my classroom. I was in no condition to be
Right,
in a classroom teaching, but the doctor didn't tell me to take some time off.
right.
Of course, being a perfect person,
Yeah, you wouldn't want to take it
I
off.
wouldn't want to take a day
You've
off.
got to be in classroom.
Right. So I was standing in the classroom, and my pupils started to dilate.
Oh, yeah.
And what was happening was I was having a reaction to that prescription.
To that prescription.
So I told a colleague, I have to go home. I can't see straight. And when I got home, I was alone. My children were in childcare. their father, my husband at the time, was working. He was a teacher as well. And I had my first anxiety attack.
Oh, yeah.
And so it was the day after I was diagnosed with depression that I had my first anxiety attack.
Anxiety, eh?
Yeah. And that's when my world changed substantially. Yeah. It's anxiety is what was happening that day was I was trying to grapple with this label. I remember the day after the diagnosis, and I was thinking, me? Depressed? How can this be? And 20 years ago, it was a very, it was sort of a no talk.
Yeah, because
rule.
back then it was something you didn't tell people.
No.
You know?
Because if I had a broken leg,
yeah, oh, fine.
I would have said, gee, I have to go home. I have a broken leg. But to accept that ugly, and I say that in quotations, word, can be debilitating for some people.
Yeah.
So
just the diagnosis itself, putting a label on what was happening to you back there 20 years ago was that in itself added to what you already experienced.
Yeah.
Yeah.
Yeah. So those 2 days started my 7-year journey with depression and anxiety.
For 7 years.
Yeah.
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 I'm wondering, I think most people do experience depression once in a while, or a clinical depression that can go on for a long time. I know that. 7 years, you said, for yourself. What was that like going day after day, year after year? What was that like for you?
It was debilitating. There are different types of depression and anxiety. Everyone experiences it differently. But what compounded my depression, I think, was my marriage fell apart.
Oh, I see.
And I had young children.
Oh, yeah.
And that would be a whole nother interview, Father Leo.
Yeah.
But what happened in my situation was it was a very acrimonious separation and lots of agency involvement with a custody dispute, etc. So my children's father called my mental health into question in the courtroom.
Oh, yes.
So I began a pattern of going off my antidepressants when I needed to go to court.
Right.
Or be in the presence of a lawyer,
Yeah.
or an office of the child's lawyer, or I decided, oh gee, I should probably go off my antidepressants because what if the court believes that I'm not a mentally fit parent?
Right.
And so that caused my 7-year experience. I don't say challenge or difficulty. It was just an experience in my life that I'm today very grateful for.
Yeah, that's true. But at the time, whatever was going on that brought on the depression, then your marriage and acrimonious, as you said, and a whole new venture being alone, a single parent. So there was a lot of adding on as the 7 years unfolded.
Yes, and that's called situational depression, as I understand it. That the situation I was in, and sort of the rocks in my backpack, those boulders and burdens that you carry, that situation caused the depression. But I now, looking back, accept responsibility that I went off my pills.
Yeah.
And that's a very dangerous thing to do.
Yeah. Right.
So, looking back, I am so blessed and fortunate and grateful that I had a very supportive family who lived halfway across the country.
Right.
And when I was in crisis, I could call them and say, help me.
Oh, yes.
And my parents would be on a plane the next day to see me. So
Right.
to help my kids, and 3 times during those 7 years, I had to take leave of absence from work because the depression was so dark. And everyone experiences it differently, but in my darkest times, I became almost comatose.
Yeah.
And I would sort of wrap into my shell like a turtle, and
Pull away, yeah.
I couldn't string words together. I couldn't read a book. I couldn't read a sentence and make sense of it. So, but I'm grateful that during those years, I had the support of my family. I had the ability to pay for medications, the ability to pay for counseling services, and when I wasn't working, or if I was going through a transition, I could support on my family, or rely on my family rather for support. So it became difficult for me to learn how to say I need help.
Yes, that'd be a difficult one.
Yeah.
Difficult for us to say I need help. Hardest words to speak. You know, I need help. But you had resources. Fortunate, you had your family, even though they were in distance. I think in Winnipeg,
British Columbia.
British Columbia. Oh my gosh.
Yeah.
They were distant, but willing to respond to you. You could rely on them. You did mention counseling. What role did the counselor or the therapist play in your working your way through depression?
When I look back on those 7 years, there were several angels in my life, and my counselor was one of them. And she used a technique called cognitive behavioral therapy.
Cognitive,
so changing the way you think.
Exactly.
And that was very helpful. She helped me through the difficult decision of becoming a single parent, and teaching me that was okay, to leave a marriage that wasn't meant to be. But I think after 7 years, I had gone through 7 distinct depressions.
Oh, yes.
And at one point I'd wondered, do I have seasonal affective disorder? Because they seem to occur in the fall.
Yeah.
Looking back, it was usually a sort of a crisis I was going through in my separation that caused that depression. But I remember after the 7th depression, I called my family members and said, I think there could be something more to this than just depression. I wonder if I have bipolar disorder.
Oh, yes.
That was the biggest, that was the most frightening moment, was accepting that maybe this is something bigger than depression.
Bigger than, yeah.
And so, fortunately, my family has connections in the medical community, and I was able to spend time with a psychiatrist for an afternoon.
Oh, yes.
After 7 years, I was given a gift of time of 3 hours with the psychiatrist. I told him my story, and he said many things, but 2 things have always stuck out in my mind. He said, Andi, first of all, the moment you accept that depression and anxiety are a part of who you are, as your hair is brown and your eyes are green, it's a part of you. Stop fighting it. You're going to go on this dose of this prescription for the rest of your life. But when you accept that it's a part of you, you'll be free. And those were his 2 truths. Accept it and stay on your meds.
Yeah.
And that was in 2008, and I have never encountered depression since.
Since that, eh? So acceptance is a big thing, eh? Because, as you said, when you were fighting it, this shouldn't happen to me. I'm a perfect person. And then just realize, well, no, this is who I really am. This is who I really am. And that has helped you. So did it ever get to the point, Andi, where you said, oh, God, I can't go on?
No. I was never suicidal.
Never suicidal.
I think it's because, possibly, well, first of all, by the grace of God, I was never suicidal. But secondly, I have 2 of the most precious children imaginable.
Right.
And I had to be there for them.
So that was...
Even though I wasn't always present during my dark times, I wasn't there.
But
that's my story. That's my reality.
In the core of your being, you knew you couldn't abandon your kids.
Nope.
And that was your anchor to living. Yeah. And that's good. I want to ask you, and I'm not one who says give advice, but supposing somebody was chatting with you today and they suddenly said, I'm really depressed and finding life difficult, what suggestions would you give them to help them work their way through this thing, because it's an experience that took you 7 years to kind of get things in order in your inner world, because we live in the two worlds, the inner world and the outer world, and both of them were stressful for you. So suppose you were going to give, not advice, but helpful suggestions to somebody today. What are some of the main things you would say to them?
Don't go at it alone. And with some, when some people experience and encounter depression and they withdraw, if that's
right.
their if that's their pattern or habit, you can withdraw, but make sure you have a lifeline who you can talk to, be it a parent, a friend, a priest, a minister, a pastor, someone you can talk to about what you're feeling,
Yeah.
because your feelings become cut off oftentimes with depression, and it's hard to bring the words together.
You kind of become numb, don't you?
Numb, completely numb. Yeah, that's an excellent way. So don't go at it alone. Many people can't afford or access counseling.
That's right.
So just to have a person who you can talk to. And hopefully be a person like you, Father Leo, someone who has counseling experiences, but someone who can just listen and not judge.
Yeah.
Another thing I've learned over the past 10 or 12 years, and I think I had to go through those 7 years to learn this, is to learn how to say no and to set boundaries.
Oh, yes.
And sometimes we are our own worst enemies in terms of overworking, overdoing, over-helping.
Over-helping people, yeah.
Yeah, and remember that you're number one.
Yeah.
It sounds like a strange way to think, but you have to look out for number one, or you can't be that teacher, that mother, that friend, that worker. You have to put yourself first.
Yeah. And you know, that's really a difficult one, because at least for a lot of Christians, because they feel guilty if they put themselves number one, and then that just brings on more depression.
Well, and that's another lesson I'm so grateful to have learned in life is guilt, remorse, shame, regret are some of the worst emotions.
Yeah, they're toxic.
To carry with inside of you. So as for example, if I was coming out of a depression and feeling well and healthy and back to work, I would feel shame for the prior 3 months.
Yeah.
And remorse and regret for the times I wasn't present with my children, or
right.
shame for not being able to go to work because
Right.
I was on a leave of absence. Those are the worst emotions, and they just spiral you back into a negative way of thinking.
Yeah, and that's why the cognitive therapy is so powerful, because it really helps a person to identify and name their thoughts. You know, the thoughts that are not helpful for mental health. You know.
I would also say, you said suggestions. I think people who are newly diagnosed and are starting on new medications, people have to be patient. Which is so challenging when you're in the throes of the experience of depression and anxiety. You have to be patient with the medications. And sometimes you get, like myself, get put on a medication that doesn't work for you.
Doesn't work for you.
Well, then you have to struggle with coming off of that medication and trying a new medication.
A new one,
yeah.
And that must be a traumatic in itself.
It is. It really is, because you want that fix.
You want the fix, yeah.
But the fix is not 100% in the form of a pill.
No.
It's a lifelong journey. Yeah.
Andi, and as we get close to finishing off here, a few more minutes, but what I'd like to say, it's been an experience for you, and a very difficult, painful experience. I hear that. How has it played a role, as you look back now, how has that 7 years played a role in you becoming the person you are today. What's been your main growth and transformation as a result of experience those very painful years?
Mm-hmm. As I said, I consider it a gift.
Mm-hmm.
That 7-year experience, and for many others, it's a lifetime.
Mm-hmm.
I consider that day with the psychiatrist a gift.
Mm-hmm. Mm-hmm.
I remember that I'm privileged to have a loving and supportive family and amazing kids.
Mm-hmm.
So I have a lot of experiences in life that other people, it's not their reality.
Mm-hmm.
I'm not living in a tent right now.
Mm-hmm.
I have a job. I
Yeah.
have a home. But to get back to your question, Father Leo, I probably have forgotten the question at this point. Oh, right.
I'll remember.
I remembered the question. I think my experience with depression and anxiety has taught me empathy
Empathy.
and an understanding that the people I pass on the street, I don't know what their daily struggles are. And so I think I've become far less judgmental.
Judgmental.
Yeah, and I think I've just become a softer, gentler person. Because of that experience. I also, you might recall, a couple of years ago, you and I went through a difficult time that we encountered a suicide and a death together. And at that time, I think it was a couple of 3 years ago now, I was becoming emotionally involved in that crisis.
Yes.
And I knew that I had to, as you taught me later, I had to set a boundary and say, I can't get emotionally wrapped up in or engaged in this crisis because I might burn out.
That's right.
And that's again, it sounds a bit egotistical, but I was taking care of myself when I set that boundary.
Yeah. But even when you say egotistical, it's ego in a good sense that I recognize. Boundary setting.
Mm-hmm.
Boundary setting. Because our people who are helpers, you, me, we have trouble setting boundaries because we want to save the world.
Mm-hmm.
And like you say, especially when you became more empathetic and can enter into the pain of people, then it's like a magnet that can drag you deeper and deeper in there if there isn't a boundary.
And you just want to help at the end of the day. Yeah. But you taught me, and I'm grateful for that lesson, that I can't be all things to everyone.
No.
So I don't think I started talking openly about my experience until about 6 or 7 years ago. And I think it's because, looking back, I had relocated to this part of Ontario.
Oh, yeah. Right.
So I had a fresh start.
Fresh start, eh? Yeah.
And I think maybe 10 years ago, perhaps that was the time that people were starting to put depression at the kitchen table, and we were starting to talk about it.
Yeah, because as I say, it was like a lot of things, it was the elephant in the kitchen, eh? Don't talk about it.
No.
You know, pretend. A lot of pretense. So more empathetic. Anything else that you can see as a human being? Do you find that you are more gentle with yourself?
Oh, yes.
Love with yourself? Yeah.
Oh, absolutely, yes.
Tell me about that.
I try very hard not to use the word should.
Right.
So I should have done that, or I shouldn't have done that.
Yeah.
I find I learn a lot from my best friend and life partner, Joe Van Couverden, and he's taught me to say, instead of saying, I should have done that, what I could say is, next time I'll consider doing this.
Yeah.
Should's a bad word.
Yeah.
Just like advice.
Yeah. Just like advice. I agree. I agree.
So what that looks like is on a rainy Saturday morning and it's miserable outside and I know I should be cleaning the house, but I really feel like reading a book.
Yeah.
I just curl up and read a book.
Yeah.
That sounds silly, but it applies in so many areas of life, work life, personal life, balance in life. Yeah. It's being gentler with oneself.
Yeah, and I get a sense what it talks to me about not being in control of your life, but in charge of your life. Now you can make choices that are right for you
Interesting.
and your health, and you're not controlled by should, ought, or must.
Should, ought, or must. Yeah. I'm also grateful that I had this experience in my 30s, because I know people who have been diagnosed in their 70s and 80s.
Yeah.
And I consider it a gift early in my life. I'm gentler with myself looking back when I was a single parent and I wasn't present for my children.
Yeah.
That's okay.
It's okay.
That's okay. It wasn't perfect, but it's good enough.
Good enough.
It was good enough.
Yeah. And that's where the thoughts come in, that if they're
The negative thinking.
negative thinking or the healthy thinking. So thoughts do have a lot to do with a lot of this stuff. You know, it really does. And that's why I'm a great advocate of cognitive psychology in dealing with depression, you know. I think we ran about out of time, Andi, and I want to really thank you for sharing so openly and honestly. I can hear your voice. It has been very painful, even for you to talk about it this morning. I can see the welling up of feelings within you.
A couple times, yeah.
Yeah,
And that's okay.
It's okay, and it should happen. If it does, it should.
Yeah.
There should.
Yeah, there it is.
No, but it's okay. And self-acceptance and having somebody to talk to, I think is really, really important, that we have at least one trusted friend, and if we have enough money to go for counseling. And I know it's unfortunate that it comes down to money, but it generally does. So I know that. And a community, in whatever way you have a community, although it's hard in our day and age, I find, Andi, first of all, for a person to tell their community, and secondly, a community doesn't realize they can play a role by being a caring, compassionate listener. Just listen, you know, and hug a person and show that love is there and that they're lovable. Because I think that's one of the big struggles you go through with depression. You know, am I lovable? Am I lovable?
Absolutely. And I'm blessed to know that I was loved.
Loved, yeah.
And continue to be loved.
Continue to be loved.
And continue to give love.
And I think knowing you and what you're doing the last few years, I can certainly tell people that you are loved and lovable by so many people who really, really do care for you.
Thank you, Father
And
Leo.
you'll always have that here in Peterborough. You are surrounded by people who care deeply about you.
Thank you.
And I wish you well.
Thank you.
So I thank you for coming today. I wish you the best. And thanks a million. And I hope that our conversation today will spark hope and strength for people, and for to say, don't be afraid to admit you're feeling depression or anxiety, and don't be afraid to find a caring listener. And if you're able to seek out a worker, a therapist of some kind, who can really lead you through and walk with you through that period of depression. So once more, thank you.
Thank you, Father Leo.
Okay,
Thank
bye.
you.